Hello all, this is Dr. Dheeraj Masapu, and today I'm going to talk about how actually being bored will make you rich. Okay, basically what I'm going to cover is I'm going to tell you, the medical specialties which people consider very boring, but there are few, even though they're boring, they will make you rich, they will make you earn a lot of money. And let us talk about the exciting ones first. Okay, the exciting ones according to me are surgical specialties. The reason being, you have very high stakes in the patient outcome. In a surgery, the surgeon's every move can actually decide the outcome of a patient. Okay, so by default, if your stakes are very high in any outcome of any situation, okay, you become the leader and you get more involved and you'll enjoy the work. So it will be very exciting for you, right? And not only for you, people who watch that, you will be given a lot of value, and you will be seen as a leader, and a lot of prestige will be there. And not only that, what I'm seeing is nowadays the cutting edge innovation, cutting edge technology, everything is coming in surgical fields only because they are able to sell the devices for very high cost to the hospitals and other areas, and then because they can generate a good revenue and a good return on the investment on that particular device. So in any way you see, the innovation is happening there, and the prestige is there, and the high stakes situation gets you more involved in the patient care. So by default, the whole field becomes exciting to work. So, but there is one problem here. The problem is that the reality is that in surgery, I call it 1% game. So that is a harsh reality I would like to tell you. The 1% game is that the elite surgeons whom you see with all the Jaguars and all the BMWs and all those people are only 1%. Unfortunately, the reason being it's very competitive, and there is something called as urban saturation. Urban saturation is in top cities. Most of the patients flow to some senior surgeons only, making them the the highly paid surgeons in that particular area. Like in Bangalore, Delhi, Mumbai, you see only few surgeons actually would be having that kind of salaries and that kind of lifestyle. And it takes time. Not everybody can reach 1% of people. Only I think there are no definitive statistics behind this, but usually I see the trend. Only 1 to 2% of people would reach that position. Okay, how to reach and all that is a separate video. But what I'm trying to tell is, even though the field is exciting, the chances of you going to such position is only 1%. Okay, not only that, the high setup costs. Okay, you have to have a very high setup cost. Hospital needs to invest a lot of money on you. You have to show a lot of revenue on that particular area, and not only that, you have to gain a lot of patient confidence, and patient flow should develop for you. That puts a lot of pressure on the people who are actually working in these exciting fields. So if you don't want all these tensions, if you don't want all these headaches, then you have to actually look at the specialties which I'm going to tell you now, which are very boring, but or at least people consider them as boring, but it's not so boring for people who are actually in that fields. Okay, but they will make you rich. So rich in the sense, I'm not telling that the specialties which I'm going to tell you are going to get you the same money as an elite surgeon, but the thing is, like, the chance of success is 30 to 40%, okay, of you becoming serious wealthy. Okay, even in these specialties which I'm going to mention now, not everybody clicks. There are certain attitudes and attributes to a character which are required. If we have those things, 30 to 40% people are making anywhere between 5 to 10 lakh rupees per month, and I consider that as a successful and rich category. You can easily reach that position. High chances and high probability. 30 to 40% is like 30 to 40 times high probability that you will reach that position compared to the exciting specialties. Okay, so what are the some of the boring specialties, but they make you money? Number one, so radiology is the first specialty which I am going to cover today. It might look boring because they have to sit in front of your X-rays, CT scans, MRIs, functional MRIs, and then reading the same scan again and again. Why it becomes boring is when you don't have a patient interaction directly. So when you're doing some work, it might become boring after a certain point, because the patient interaction, when you have to tell something to the patient, when he's questioning you or relative is questioning you, it forms a loop and it becomes a little excited. When you read a scan and give a report, it might become like an office job, and then what happens is, because I don't call it lack of ownership, but some element of ownership would be more for clinical specialties. So that makes the job exciting. In that way, I feel that some element of boredom is there in radiology. That to teleradiology, if you go to even more, it will be boring. So, but they are paid very well. They are paid anywhere between 3 to 4 lakhs immediately after your MD. Not immediately, maybe 2 to 3 years experience is required. But serious money is being given to all the juniors. But there is a ceiling. Okay, ceiling is like maybe 5 to 10 lakhs they can earn. And around 45 to 50 years of age, once you will reach that level. But anywhere between 3 to 5 lakhs, aram se you can earn. I think that's a good salary. And in surgical specialties, to reach that salary in that phase is very, very, very tough. Okay, but if you take some specialties like interventional radiology, neuroradiology, diagnostic radiology with AI and all that, you will be paid even more money. And so the probability of success is 40% of radiologists, I feel, can reach anywhere between 5 to 10 lakhs in 10 to 15 years with 10 plus years of experience. And that's a very, very, very good number to settle, I feel so. Next specialty is our specialty, that is anesthesiology. And why it is boring, anesthesiologist, after inducing, you have to sit in front of the system, monitor vitals, nothing will happen most of the times, but sometimes things will go wrong. That is why you need experts. Okay, but the problem is, they are paid very, very well. So as a beginner, you will be paid 1.2 to 2 lakhs, and freelancing, if you do, anywhere between 2 to 3 lakhs you can earn. But with 5 to 10 years experience, anywhere between 3 to 6 lakhs you can earn aram se in big metros, if you plan your career well. Okay, plan your career well means if your CV is good, if you are actually placed in a good institute, and then if you have some leadership qualities, you will reach. If you are a loser, you cannot do. That is why 35 to 40% only I'm giving. 35 to 40% is that 35 to 40% anesthesiologists can reach this level financially. Okay, not everyone. Okay, everyone cannot become this. So that is with the anesthesia. You can also venture into pain medicine, set up your own clinics. You can venture into neuro anesthesia, cardiac anesthesia, pediatric anesthesia, and all that. But you need good attitude, leadership, and all that to reach this level of 4 to 6 lakhs or 4 to 8 lakhs salaries. Okay, 35 to 40%. And the next specialty I would say is pathology. Pathology is a diagnostic specialty. It will be boring, no doubt in that. You have to see in the microscope, all the slides and all would be there. But thing is, if you venture into hematopathology or other DMs in oncopathology and all that, you are paid very nicely in cities, and with 3 to 4 years experience, you are paid anywhere around 2 to 3 lakh rupees, and then it might go up to 4 also if you are actually leading a position. And so I feel pathology also is a good option. So around 20 to 30% or 15 to 20% of pathologists would actually reach the crazy salaries which I mentioned. Not everyone. Okay, disclaimer, I am telling you multiple times, guys, not everyone can do this. Leadership is required. Psychiatry also little boring specialty because you have to sit in front of the patient and listen to his whole story. Psychiatrists listen for hours and hours is what we usually think. At least 20 to 30 minutes of counseling would be there with every patient. And but they are making very good money in cities. Particularly the people who are setting up their own OPDs, around some gated communities who have are making good amount of money. Not only that, child and adolescent psychiatry, whoever is doing, are getting a lot of autism cases, and they are also making good amount of money. Anywhere between 4 to 6 lakhs you can make if you set up your own clinic, if it becomes moderately successful. If it is super successful, there are people who are making 10 plus lakhs also. So anywhere between 30 to 35% is what I can give for psychiatry to become super rich. So it is another. And number 5 is boring and rich category is physicians, general medicine. So here pulmonology, general medicine, and all those things you can keep here, and all the super specialties also you can aram se fit in this section, because you have to sit with patients. Most of the cases are routine. Every case wouldn't be challenging, right? Most of the cases are respiratory tract infections or uncontrolled diabetes or this kind of, you don't require much specialization to deal these cases. So the excitement level would be low, but if your practice clicks, if 100 patients, 200 patients come to your OPD, then you would make anywhere between 8 to 10 lakhs per month. So not every physician can reach this level. I can keep 30 to 40% of physicians who set up their OPDs would reach. Even in corporates, I am seeing many physicians who are building very good patient bases are being paid handsome amount of money because they'll have some cut in the salary. So hospital takes some amount, they'll get some amount, some distribution would be there. It will be varying based on the hospital they're working. And so they are also making decent amount of money. So 35 to 40% of people would actually make. Next is number 6 in the line, boring and making money, is nuclear medicine. Nuclear medicine advantage is that even though it is boring, you just give radioisotopes and sit in front. It will be boring reading the scans and all that. Again, lack of patient direct accountability and interaction would actually decrease the excitement level, but high salaries are being paid even for freshers who finish their MD. Directly 3+ lakh salary is being given in all the corporates because demand supply mismatches there in this, and that wouldn't be there for a long time. It would be there for another 2-3 years. After that, maybe more people will be produced. So whoever is doing now would have a beginner advantage. So think about nuclear medicine also. And it seems theranostics is a new field which is coming there. That is more about not only imaging. They're trying to tag the medicine also to the radioisotope that they're giving, and the radioisotope would go to the area of the tumor and attack it. Okay, something is going on. Theranostics it is called. Okay, so the last but not the least, boring, and my personal favorite is PMR, physical medicine rehabilitation. If you give me a time machine, then I would have gone back and done this. The reason being, I would have set up my own franchise of senior citizen facilities in cities, because a lot of people, it's a burning problem in city. See, all the parents of people who are settled in USA, UK, there is nobody. Many of my friends who settled in UK and USA would call me requesting for help if something happens to their parents. So if you can set up a senior citizen facility with the help of a trust or a Tata is actually working on that, right? Senior citizen facility. If you can actually collaborate with some trust and invest some money and set up, then even though it's a boring field, because the recovery is very long term, you don't see an immediate result here, but you can actually make a serious amount of money here, anywhere between 5 to 10 lakhs you can make. Again, not everyone who has that entrepreneurial spirit only can do. Otherwise, even with a job, if you go to corporate hospitals, I was working with Dr. Maheshwarappa in Sakra Hospital. He's the best I've seen till now. He has robots and all that. So they all would be making a lot of money. So that is because it also depends upon the nature of the person who is doing. If you're passionate about the field, if you have good attitude, leadership, then in all these boring specialties which I mentioned, you can make significant amount of money. Okay, so this is about boring and rich. Hope you liked this particular video, and this video would add a lot of value to your lives. And okay, so to conclude, if you want to become that 1% or 2% of that elite surgeon who is driving the Jaguar, then you are actually taking 30 to 40 times more risk than these specialties, where 30 to 40% possibility of making a very good package is there. Okay, if you are active leadership kind of a person. So you think about it. What I'm trying to tell is, rather than betting on something where your chances are 1 to 2%, better bet on something which has 30 to 40% chance. So your chances of getting that are 30 to 40 times more than that. Logically, that makes more sense to me. You actually think about your, you also do the math, you'll understand. Okay, because I've seen multiple people, and then surgical means actually orthopedics also would come in that category. So all those you can put in that 1 to 2% list. So boring is not only making you rich, boring is brilliant. Okay, that is the tagline. Boring is brilliant. Okay, hope you take some boring field and then make more money. Okay, thank you very much. Thank you guys for following the video till then.